I recognize the honourable member for Fairview-Clayton Park.
Speaker, midwives do such important work, and I am so lucky to have a midwife right now, but not everyone is so lucky. In fact, during estimates, the Minister of Health said Nova Scotia midwives help with 200 to 350 pregnancies a year. But last year, more than 300 people who needed midwifery care didn't get it. That means that the number of people who can get care and the number of people who can't is practically the same. Why are hundreds of Nova Scotians being left without access to midwifery care when they need it?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. So certainly, as I said in budget estimates, I was very upfront about it. The question can be asked 100 times. We're not expanding midwifery programs in this budget. That won't happen this year. But people can get good, wonderful obstetrical care in this province. Some people get it from obstetricians. Some people get their care from a primary health care team. Some folks get it from a primary care provider. Some folks get their care directly from a midwife. So we'll continue to look at the resources that we have available to us. What's the most important is a healthy mom and a healthy baby. We'll continue to stay on those principles, and we'll see what the art of the possible is in future years.
I recognize, for the people in the gallery, if they'd like to have full-on conversations, I ask that they leave or whisper. I recognize the honourable member for Fairview-Clayton Park.
Speaker, when half of the people who need midwifery care can't get it, that is a problem. Nova Scotia is well below the national average when it comes to the number of midwives working here. With less than 3 midwives for every 100,000 people, midwives reduce strain on our healthcare system, they give much needed support to new families, and they want to do more of this work and not less. When will this government truly support midwifery care in Nova Scotia?
I recognize the Honourable Minister of Health and Wellness.
Thank you. So as I said, the current model in Nova Scotia is primary care providers, predominantly GPs in many communities. We do have some midwives, which we really appreciate the support and the care that they provide, and also obstetrical physicians, obstetricians. We're going to continue to focus on healthy moms, healthy babies, good outcomes for folks across this province. We will not be expanding the midwife program this year.